officially have 2 o'clock, so I'm going to go ahead and get started. So hello, everyone. Welcome to Providing Mental Health Resources at your library. My name is Tiffany Chavis, and I'm the Outreach and Education Librarian for Region 1 at the NNLM. Okay, so moving on. In today's session, we're going to cover some mental health definitions and statistics, tips for reference interactions. We'll highlight some mental health information resources, and we'll look at some ideas for programming and services around mental health. Now, I want to be clear, one thing that we will not be talking about today is how to manage someone in your library who's experiencing a mental health crisis. We here at the NNLM recognize that this is an important skill for public service staff, but we feel we are not the people to be offering advice on the issue since we're generally not mental health experts. With that said, let's get started. Okay, so mental health includes our emotional, psychological, and social well-being. It affects how we think, how we feel, and act as we go through life. It also helps determine how we handle stress, relate to others, and make choices. Mental health refers to a wide range of conditions and disorders that affect our mood, thinking, and behavior. Examples of mental illnesses include depression, anxiety, schizophrenia, eating disorders, and substance use disorders, and that's just to name a few. I don't know if any of you have seen the DSM. It's quite the heavy book. While a mental illness can make life more challenging, it's not uncommon by any means. Many folks have mental health disorders or concerns from time to time, just, in general because of life. It becomes problematic if left unmanaged or untreated and may become a serious condition affecting one's activities of daily living. As an organization, you can provide quality health information to your patrons to learn about mental health topics. This can be regarding a particular illness, or it may be during a stressful event such as a disease outbreak, a natural disaster, or even having a baby or adopting a child. So let's start by looking at a couple mental health facts. So from a report published in 2022, in December 22, mental illness is prevalent across the United States, and it can affect folks of all ages, so children and older adults as well. In 2021, in 2021, 1 in 5 American adults had a diagnosable mental health condition. That comes to about 58 million adults over 18. So that's not even including children that suffer with mental illness or a mental health condition. So from here, we're going to switch gears and look at how best to address mental health information requests in your libraries or your community programs. Okay, so this is going to be a long slide, folks. Mental health questions can come to you in many ways, but just use the same approach as you would with any other reference interview. So the reference interview might present itself anonymously over chat, over the phone, in person at a reference desk, or through a research consultation with a student. What starts as a research question could easily turn into a question for mental health information or even a service referral. Let's say you get a question from a patron who has a child with an eating disorder and is struggling to make sense of their child's experience. They want information, so what do? You would use the same approach that you would for any other reference interview. Again, drill that in there. Respect confidentiality by lowering your voice, or maybe bring the patron to a quiet area, but somewhere where you can still be seen by others. Active listening shows that you're paying attention. Also, by maintaining an open body position, for example, not crossing your arms and maintaining comfortable eye contact is also helpful to put the person at ease. Keep in mind that there are various cultural views on eye contact, though. Um, Ask open-ended questions. Ask neutral questions. This would result in getting more information and not just yes or no answers. Be sure to let the patron finish their questions before responding to them. Don't try and finish their sentences or anything like that. Be empathetic and patient. Know that the patron may not be aware of the potential impact or seriousness of a disorder, so be prepared for a possible emotional reaction. If that patron is having a hard time asking a question, be patient. Um, Once they've asked their question, maybe say something encouraging or supportive if you feel like it's appropriate. Do not share your personal stories to demonstrate that you understand. This may convey the wrong message because everyone's, situation is very different. They're there to have their needs met, not the other way around. So keep that in mind. This may be difficult for some of you, but allow time for silence. It may be the moment someone is taking time to gather themselves to process the information that you just provided or determine if they want or need to ask further questions. You too might need to take a moment to think through and where to look for the resources and gather your own thoughts based on what they just asked. It's very important to know the difference between providing health information and giving health advice. As you know, we are librarians and we don't give medical advice. It's best to refer individuals to their healthcare providers if they have questions that go beyond the scope of providing information. Also, whether a patron has a mental illness or not, but is asking questions that we feel are outside of reality, just seem a little off, it's okay to answer them matter-of-factly. Take the person seriously as you would any other patron in your library. And at this time, I'm going to ask if there are any questions. Rebecca, do you see anything in the chat?
No, there's nothing in chat yet.
Okay, great. I am going to keep on moving along here. So from here out, I guess I'll just save all the questions for the end. Okay, so I briefly mentioned this on a slide before. You'll see listed here some examples of open-ended questions you can use while you're doing that interview with a patron to figure out what they're looking for exactly. Ask those open-ended questions to clarify the patron's needs. Are they looking for health information? Are they looking for local services? Are they looking for a support group? Is the information I need for a class assignment? If clarification is needed, just ask. So say maybe, I'm not certain I understand. Can you give me an example or can you tell me more? Just as important to ask open-ended questions, it's also important to listen without judgment. This slide is from the Mental Health First Aid website called Mental Health First Aid is the name of the website, sorry, describing the 5 tips for non-judgmental listening. And that's reflect on your own state of mind, adopt an attitude of acceptance, develop verbal skills to show you are listening, maintain positive body language, and recognize the cultural differences around mental health. Mental Health First Aid is an organization providing training, including becoming an instructor who can then train the rest of the library staff in your library. But be aware there is a fee associated with this service. They also have an excellent collection of mental health resources on their website that you can look at. So consider subscribing to their newsletter for tips and information. Keep in mind that you also You may also be able to find a training through your local mental health organization or maybe through your local health department as well. I know here in Region 1, we are in the process of hosting a mental health first aid training. For those of you that work out of Region 1, I believe it's supposed to be in March, so keep an eye on the training calendar for that. And lastly, NNLM offers an on-demand class called Introduction to Health Reference that goes into more details about library policies. We have a link for that on the handout that you can take a look at as well. Okay, now let's take a look at some mental health information resources and then review a few ideas and examples of programs and services for your library. Some of the mental health resources I'll be going over may look familiar, but you might find some new resources to consider as well. We won't be going live to any of the sites, but the handout that was provided for this session will have all the links so you can explore the resources on your own. Okay. So the NNLM has a resource guide for public libraries. Though any library may find this useful, and it includes behavioral and mental health information, as noted in the right-hand sidebar there. Many of the resources I'll be mentioning today are also located in the guide that you see here on the website. Okay, many of you are probably already familiar with Medline Plus, but just in case, Medline Plus is an online health information resource from the National Library of Medicine. It's for patients and their families and friends. Clicking on the Health Topics tab will display a variety of categories, and mental health is located under disorders and conditions, which is a good place to start. You can also use the search box at the top to find other results within Medline Plus. Medline Plus brings authoritative resources to you and your patrons. You don't have to go to the American Academy of Pediatrics or familydoctor.org. You don't have to do searches in Google and wonder if the search results are quality or if they're legit. The resources contained in Medline Plus must meet the site's strict criteria for inclusion. The health topic pages are organized alphabetically, so it's a little easier to find things. Here's a screenshot of the health topic page on child mental health. Notice that there's a table of contents here at the top. You can click directly on any of these links to jump to that section, or you can simply just scroll down the page to view other content. For a user who's not sure what they're looking for, you might find the Start Here content helpful. There's information and links for diagnoses and tests, and on treatment and therapies, and sources for the information are noted on the page as well. Over to the right, you'll see a section titled Related Health Topics. For example, bullying and cyberbullying and child behavior disorders are related topics to child mental health. And those might provide additional information for the user or for yourself. If you continue to scroll down, you'll see that there are links to journal article citations that can be found in PubMed. And that's where the medical literature can be found. Additionally, you can find an expert, age-appropriate information for children and patient handouts. Some of the handouts are languages other than English. Returning to the Medline Plus homepage, on this screenshot, you'll see a link for health information in multiple languages. You can browse health information in various languages or by health topic. On the second screenshot, You'll see that there's a list of multiple languages for handouts related to depression, sorry. Here's an example of a handout on feeling sad in Arabic. Oh, where is my...
If you go ahead and click on the slide again, it'll advance the animation.
Oh, there it
you
is. Okay. So where was I? Okay, so notice that this handout also has information in English as well, which is helpful if a patron takes it to their doctor, so the doctor can know exactly what's being included in that handout. All topics in a language other than English will also have an English version. Oh, there it is. Okay. All right, from the sitemap, Medline Plus provides links to directories to help find libraries, health professionals, services, and facilities. Now, NLM does not endorse or recommend the organizations that produce these directories, nor the individuals or organizations that are included in the directories. Also from the sitemap, you can view the list of organizations and agencies whose materials appear on Medline Plus on the health topics pages. These organizations include NIH institutes, centers and offices, and other U.S. federal government agencies, and selected non-government organizations as well. Please don't limit yourself to what's listed, in Medline Plus or in these lists here. Your state health departments will also have information on local services that may not be included in these lists. So this is a place you want to start, or even your local health department that would give you, the most detailed information for your area. Medication may be prescribed as a part of treatment for someone who has a mental illness. If that is the case, Medline Plus also has information on medications. Medline Plus uses information provided by the American Society of Health System Pharmacists. Information about herbs and supplements is also available on Medline Plus. You may receive questions about complementary or non-prescription medications. This is a reliable source to use for that information as well. Medline Plus pulls from a variety of authoritative resources like the Natural Medicine's Comprehensive Database, the NIH Office of Dietary Supplements, and the National Center for Complementary and Integrative Health. And I'm pretty sure we have a class on that as well that you can look up if you're interested. This is a screenshot. That's an example of an information page of an antidepressant. You can go ahead and you can click on the different links to find that section on the page that will provide different information about that one medication. Okay, this is from a Medline Plus medication page. So notice the red highlighting around the box. The box provides important warning information from the Food and Drug Administration, so the FDA. You'll see this whenever the FDA issues a warning. Another source of information about medications is Daily Med. I'm sorry, I'm so used to saying Medline Plus at this point. Daily Med. Daily Med is a joint effort between the National Library of Medicine and the FDA. Currently, it contains over 150,000 labels submitted to the Food and Drug Administration by drug manufacturing companies. You can find the packaging and package inserts that are included with the prescriptions. There's also a link in the upper right-hand corner that will take you to the recalls of FDA-regulated products. Now, keep in mind that Daily Med does not contain a complete listing of all FDA-regulated products. You can learn more about what is and isn't included in the databases by clicking on About Daily Med below the search box. Oh, sorry about that. Okay. This screenshot is for an antidepressant medication. We just looked at it, same one, in Medline Plus. Notice the label RSS link in the upper right-hand corner. You can subscribe to the RSS feed for a specific label and be notified of changes and news that may come out about, a particular medication. And of course, you may have other medication resources available in your library collection. So just be sure that they are as current as possible, that's the most updated information on those, on that medication information. For those of you looking for alternative and complementary treatments, they can visit the National Center for Complementary and Integrative Health for authoritative information. I just mentioned that in the resource cited in Medline Plus. The NCCIH is one of the 27 institutes of the National Institutes of Health. They conduct and support research and provide information about complementary health products and practices. Okay, here is an entry on depression in the NICCH. On the right-hand side, there are links to research on the efficacy of other modalities of treatment for depression. Another resource is the National Institute of Mental Health, which provides information on specific conditions and treatments along with free materials that you can download or order for your library or for you and your personal use. Keep in mind that other institutes and centers may also have information, such as the National Institute on Aging or the National Institute on Minority Health, which may have mental health information that's more specific to those populations or the populations you may be working with. Okay, here is SAMHSA, which is the Substance Abuse and Mental Health Services Administration, and it's part of the U.S. Department of Health and Human Services. Its website includes information for the public and for professionals. Topics include school and campus health, seeking help after traumatic events, such as natural disasters or shootings, and of course, coping with COVID-19. SAMHSA is a good resource if you're planning a program or a service, but for some, this resource may seem a bit overwhelming. You might want to take some time to explore the website on your own and select specific links that you think your patrons would find most useful. They also have publications that are free to download and order. You might consider having some copies available at your circulation desk or creating a LibGuide, or maybe distributing these resources at a library program or in a brochure area, wherever that is in your library. Some information is also in Spanish as well. I'm sure many of us are now more aware of the CDC, of the Center for Disease Control, due to the pandemic. But what you may not know is that the CDC also provides information on mental health, for both professionals and for the public. Their website has information on mental health, including tools and resources, quizzes and data. The CDC mental health resources can be good to evaluate yourself or to gather information for a program or service, but members of your community may find it helpful as well. Another organization that provides mental health resources is the National Alliance on Mental Illness, or what's known as NAMI. NAMI has resources for people with mental health conditions, including a peer-to-peer support group, and they're located throughout the United States as well. So in addition to those peer-to-peer support groups, they also provide mental health resources and classes. They also provide support groups for families as well, families of those suffering with mental illness. The resources I just highlighted can be helpful when updating your subject guides and your toolkits. These may also be useful when you're creating services and planning programs. Next, I'll talk you through some ideas for services and programs you can host in your own libraries. So, have any of you hosted a National Library of Medicine exhibit such as the Harry Potter or the Yellow Wallpaper exhibition at your library? You can learn more about the traveling exhibits and how to request to host one by joining the Making Exhibition Connections listserv. The link to that information is going to be on the handout that we provide. One of the newer NLM exhibits is Care and Custody, Past Responses to Mental Health. This is a traveling exhibit, also has an online exhibit. It explores the treatment of people with mental health conditions in the past, and examines the history to understand how the country has moved away from custodial forms of treatment to more inclusive approaches that have worked to protect the rights of people with mental health conditions. So the online exhibit includes an educational component and a digital gallery of selected works from historical collections at NLM. Many graphic books address the topic of health, including mental health, creating a unique opportunity for readers to learn about healthcare experiences. The graphic medicine website, graphicmedicine.org, has a blog and a podcast and lots of great books to feature and perhaps to purchase for your own collections at your libraries. Graphic Medicine, Ill-Conceived and Well-Drawn is an NLM exhibit about the use of comics and graphic novels as a way to communicate about health, which does not include mental health. We actually just did something similar here at our library at University of Maryland, Baltimore, but we enlisted students from a local school, and they all created their own comic strips about health issues in their lives, whether it's themselves or a family member. So that's a program you can do at your library. In 2020, the World Health Organization produced an informative resource using the graphic novel approach called Doing What Matters in Times of Stress. It helps equip people with practical skills to cope with stressful situations. It's downloadable and it comes in several languages. It is about 132 pages and it looks very much like what you see here. So it's not 132 pages of text, paragraphs of text. They also have an audio exercise, some that are in multiple languages as well. You might consider hosting a comic artist at your library to give a program for teens or adults where they can learn how to create their own comics to address some of the challenging times in their lives. So very similar to what we did here at our library with our community outreach with the students at a local school. Books can make it easier to talk about topics that we may know little about or might be uncomfortable with. The NNLM Reading Club offers titles and added information regarding health topics to enrich your discussions at your libraries. There's a link on the handout as well to the club section on our website. May is Mental Health Awareness Month, and you may want to plan a library event to provide information and awareness to your community. Some organizations provide social media images and text and hashtags for you all to use as well. Last year, the NAMI's campaign included the hashtag More Than Enough campaign. Stigma can definitely be a barrier for people seeking treatment for their mental health issue. Participants in a Stop Stigma campaign can be one way to bring awareness and reduce stigma in your community by discussing how mental health is a part of one's overall health and therefore is interrelated with any other health topic. Your libraries could do this through your social media or other creative ways to participate, such as offering stickers or wearing t-shirts or maybe even holding a, let's say, a button making contest. If you're still not sure what program to offer, we got one more resource for you. It's a programming librarian, and it's a place where libraries can share and find programs focusing on health or a variety of topics. You can search by the type of library or search by the topic that you're looking for. Here you can see a post about self-care for university students. Are any of you out there doing any programming at your library around mental health? You want to go ahead and put that in chat for us and see what you all are doing out there? Okay. Oh, we used to have a program called Rest More that was for taking time out for your mental health. That's good. Therapy dogs. Looks like you're on the same page as this university was during finals week. Yep, we actually just did that here at our university library as well. Panel 8 community members, faculty and staff and counselors on staff. Talk about mental health. Stress week, wellness and self-care for summer journaling. Okay, art more. Okay, so it looks like a lot of you are already starting this work at your libraries and on your campuses. So that is definitely good to hear. So yes, if you're looking at ideas, definitely go look at the chat, folks, and see what inspires you. Yeah, Suicide Prevention Month is September. That's some work around that. Okay. All right, well, thank you so much for those. Okay, so these are some other possible resources or programs that you might want to consider for your library. Some school libraries have brought in therapy dogs, as we just mentioned, around finals to help students reduce their stress. Events like this can help give people permission to talk about mental health in an open environment, breaking down that stigma. It helps normalize things, and it gives the library a chance to provide additional mental health information. And that brings us to the end of our presentation. Does anyone have any questions for me? If you do, go ahead and put those in the chat for me.
There's a question, Tiffany. What are your thoughts on bibliotherapy in libraries? Do you have any good examples? And we may want to open that question up to the audience.
Yeah, I do not have any examples of bibliotherapy. Does anyone else out there have any examples or any experience with using that in their library?
Okay, Esther says there was an excellent book about bibliotherapy for librarians from ALA. So something to look at.
Yeah, I think you might find information too on the Reading Club site about it possibly, just because that's essentially what, you're trying to do with having these book clubs, with people learning more about certain diseases or mental health issue and so forth. Standard learner-based versus exhibition or groups. I would check out some, speaking to Laura, who had concerns about space and doing programming at her library. Maybe check out some of the resources that were provided in the webinar and on your handout. There may be some smaller options. So like you were saying, you mentioned stickers, maybe some smaller pamphlets, things like that can be used. I know SAMHSA does a lot of work, like whether it's stuff for social media, it's stuff, handouts and things like that, like around Recovery Month every September. So yeah, I would check out the resources and see what they have to offer. Here's another question about capturing data in reference to the effectiveness of their programs. Does anyone want to comment on that? Is anyone capturing that data when they're doing programs around mental health in their libraries? I see the comment by Robert saying that they track the data on circulating materials. It's kind of tough I would think, in a library setting to evaluate the effectiveness, because you would have to rely on the word of your patrons on whether or not something was effective. And then two, depending on the situation, it may be them divulging, personal information they're not quite ready to divulge, considering the subject matter and the stigma attached to mental health or mental illnesses. It could be a tough ask. But I guess there are creative ways, as Robert mentioned, tracking the circulation of certain materials. Okay, Amelia just put up information about about some LGBTQ display that they did in their library. Did I catch all the questions so far, Rebecca?
Yep, I believe that is everything.
Thanks for watching. This video was produced by the network of the National Library of Medicine. Select the circular channel icon to subscribe to our channel, or select a video thumbnail to watch another video from the channel.